The Conemaugh Connection is brought to you as a public service by the Conemaugh Health System.
Surgery that years ago used to result in a 6-month body cast. Now patients are going home the next day.
I could have fell over when he said, if you feel well enough to go home.
At 35, this father of 2 was told he would not make it to 40.
To be able to have the outcome that I have now is just amazing.
Plus cooling the body to help reduce brain injury.
You know, with the old system, you sort of had to pick between the heart or the brain.
I'm Amy Bradley. Welcome to the Conemaugh Connection. We'll have these stories and more coming up in our program. But first, Memorial Medical Center was recently recognized as one of the nation's top hospitals. This presentation of the 2008 Distinguished Hospital Award by Health Grades means out of 5,000 hospitals in the entire country, Memorial ranks in the top 5% for overall clinical excellence. What does this mean for you?
We, of course, work every day to be as high quality as we can. This is just the fruit of that effort.
It's an awesome accomplishment. It's one that could never have been achieved without every single person within this organization.
More than 16,000 patients come through our operating rooms each year. Not surprisingly, our high volumes and experienced team have contributed to stellar marks for general surgery. For some, surgical advancements mean getting back in the game or back on their feet. For others, it's truly a second chance at life and not having to say goodbye too soon. In soccer, being goalie or keeper is a demanding job.
It's stressful because you have to do a lot of quick motions, sudden stops and turns and dives and hitting the ground a lot.
Cal U keeper Hannah Spiegel was just heading into a new season.
And I was going up to make a save. I play keeper, and I landed just not very well in a hole and my knee gave out.
An MRI revealed a torn ACL, one of 4 ligaments that are critical to the stability of the knee. For high-demand patients, athletes like Hannah, there's a new surgical option called double bundle ACL reconstruction.
That in the past, we would reconstruct only one of the 2 bundles of the ACL, which contains the anteromedial and posterolateral bundles. And this procedure tries to restore more normal anatomy and kinematics of the knee by reconstructing both bundles of the ACL. A standard ACL reconstruction works well for 85 to 90% of patients. In about 10 to 15% of patients, occasionally residual instability persists.
A busy Hannah is already back to helping out on the family farm, working a part-time job, and working hard to strengthen her knee and get back to the pace she's used to.
I like to be active and doing things and running and keeping in shape and keeping my body healthy.
Along with new procedures in the operating room comes new ways of doing old procedures. In 1972, Thomas Gutsky had spine surgery that left him in a body cast for 6 months.
It was solid, from my neck down to my hips. And in the evenings when I'd go to bed, I could take that off. But I had another brace that I had to put on to sleep in. And after I had all this done, they had to actually teach me how to get up and walk again.
Now, 35 years later, when pain once again began shooting down his leg, Tom was facing a much different procedure.
We did a spinal fusion in December. He was out of the hospital next day, wore no brace, and so he was just overjoyed.
Dr. Chowdhury and his colleagues at Conemaugh Neurosurgery are now able to do many spine procedures with minimally invasive techniques.
I've had patients who've had previous surgeries and then they had minimally invasive surgery, and they can really tell the difference.
I could have fell over when he said, if you feel well enough to go home. And I said about the braces, and he said, we don't do that no more. There's no braces.
I'm very excited to be part of this. Learning new things, new techniques, and seeing patients get better.
Tom now spends 2 hours a week in outpatient aquatherapy at the Crichton Center and is otherwise back to a normal, pain-free routine. Sean Toth, a 35-year-old single father of two, had been told by doctors at other hospitals that there was nothing that could be done to help his rare genetic abnormality called pancreatic divisum.
It's a very severe, debilitating pain. It's almost like having a spear shoved through you and out your back. The pain radiates from the front to the back. And the other downside to it, the organs were digesting themselves.
For nearly 10 years, Sean was in and out of many hospitals, at one point spending 8 months in a hospital bed, down to a mere 105 pounds.
So I missed almost an entire year with my kids, with just sporadic in between getting to see them, and it just, you miss their birthdays, you miss Christmas. It was horrible.
It was scary because everything changed, because every morning when I was about to go to school, I didn't see my dad, and I usually see my dad when I wake up, and I was really, really scared that one day when I'm in school, I might not see my dad, and he might be dying in the hospital.
He was told to go home and prepare for the end. But ironically, after searching for treatment at hospitals across the nation, Sean's salvation came in his own hometown, in the hands of Dr. James Gregory and his colleagues at Conemaugh Surgical Associates.
He's very grateful. He's very grateful that we were willing to take the chance. To be honest, he had come to the point in his life where he would have actually rather have died in the operating room than continue with the problem that he had.
I truly believe that, God brought Dr. Gregory here to Johnstown to help me. And to fly through the surgery like he did, and to be able to have the outcome that I have now, is just amazing.
Amazing results thanks to a surgical team that has brought a new level of expertise to our area.
From a geography standpoint, for patients to get this surgery here and have the same results they would at another university center is a great advantage, I think, to the people in this area who, traveling is difficult out here.
Sean is now being weaned off of the pain medication that he has needed to make it through the past decade. He's looking forward to a possible career in healthcare and making up for lost time with his girls.
When you're used to something for 10 years, telling you that you couldn't do this and, robbing you of everything that you enjoy in your life, and then you're giving it back, what can you say? I mean, that's the best gift that you could ever ask for, so.
I want to say thank you, because if they didn't get his pancreas out, then he would probably die, and that's the last thing I want him to do.
Such a great story. To learn more about different types of surgery, you can check out our website, www.conemaugh.org. There you'll also be able to watch longer, more in-depth interviews with the physicians we spoke with for this program. Coming up, can cooling the body help prevent brain injury? See this new technology in use today at Memorial. But first, throughout our show, we'd like to give you a glimpse at our Health Grades report card and hear what it means to the doctors and caregivers who provide such excellent care.
And we offer the latest in terms of technology, in terms of procedures here at Memorial in Johnstown.